This is Ice Cream Gecko, and I think it is time for some unqualified coronavirus speculation. Now, at first, let's talk about numbers, because of course that's what everybody's interested in. We are all loving about the numbers, and the numbers that you might not want to trust from the Chinese government. It's just a flu, bro, no need to honk. Now, everything I say about this topic you shall take with a grain of salt, because I am not a professional in the field of any sort. I am not very well educated in that topic either. I am just a biology student, and all the information that I get about this is taken from the internet, just like the research that you might do your own. You're probably interested in this topic because you clicked on this video, and a video that is called Unqualified Coronavirus Speculation, isn't really advertising itself. Now, the numbers from the Chinese government, they were a bit fishy from the start, let's be honest. I mean, they didn't do anything publicly up until it was half a month in, and people started to notice some things are weird, and some people started to disappear, and I do not know if people are still disappearing for speaking out about this, but they certainly did in the first few weeks of the outbreak, which is unfortunate. Really makes you think. They say, don't scaremonger, don't wreak havoc, don't panic, don't make other people panic. But at the end of the day, spreading information, spreading facts, and calling facts rumors just because the Chinese government or the government that you're living under doesn't approve of them, that's really not scaremongering. That's just being oppressed by a state. But the numbers have always been fishy, and that will not change in China. We'll probably find out in 10-15 years time what this is really, what really has been going on, where this came from in the end. There are 3 laboratories pretty close to that market. There have been rumors, scaremongering tactics around to that state that they might be working on something, that something might have escaped a laboratory, that bats defecated on some scientists in some way or another. I mean, that's a pretty, if that would be true, that's a pretty embarrassing statement that you have to make at a press conference. Yeah, the entire world got infected with this deadly virus because somebody got pissed on by a bat. Just rumors, though. Just rumors. I do not believe them, of course. I do not believe them. Scaremongering tactics, that's what they are. Something else that is weird, and something else that is unfortunately very unclear at this moment, is the infection rate at which this thing is going on. Of course, the Chinese numbers didn't lead up to much reliable information and reliable conclusions, justifiable conclusions, because they were understated, really. I mean, they didn't count many of the cases at first. They've got like fever clinics where they put people who've got fever, but then again, fever is kind of the thing with this SARS-CoV-2. That's what happens when you get it. So those people weren't counted at first. Maybe they've cleared up everything now, but I'm not too sure about that. And another thing about the numbers is that the numbers in Europe, especially in Europe where I live, in Germany, are currently increasing in a way that is making me a bit uncomfortable, if I'm honest. I'm not outright scared by this, but I'm concerned. Because I've got the feeling that many people will suffer severely from this here in Germany as well. Not at last because our government is basically trying to keep things on the down low. There's massive lowballing going on. The modes of transmission, that's a big topic, and that appears to be somewhat solved, because it basically can be transmitted through everything you could possibly imagine. it's not just that you have to have physical contact. You've got your usual droplet infection, just with influenza as well. I mean, that's common knowledge now. And that's really all that many government institutions here in Germany also led on to. And the stuff with the aerosolization of the bloody thing, that isn't really talked about at all. And that's the most scary part of this entire shenanigan. That this can be spread via the air. I mean, droplet infection is also spread via the air, but you have to have some kind of propulsion for the droplets with the virus in them to be, you know, transmitted. When you've got the bloody thing in aerosol, you do not need any propulsion. A bit of it at first to get it into the air, but after that it basically floats around on its own because it's just too damn light. And that's the really scary part when it comes to the transmission of this virus. That's the one that gets me a little bit. Because it's outright scary. You know, you don't have to be sneezed on by somebody or have to touch something that's contaminated. No, you're just in the room or in the hallway, and somebody a few minutes ago just coughed, or maybe didn't even do that, just breathe, who had that, and now you are in danger of getting that. That's quite scary, if I'm honest. Scary, is that the right word for it? Concerned. Yeah, but I think it's justified to be a little bit scared about this. You know, it's in the end of the day, it's a deadly disease. Shouldn't be laughing about this, but that's the gallows humor that I'm into, because I cannot not laugh about this. You know, at first, when all the people said, "Oh, it's just the flu, bro. Nothing to worry about. It's just the flu. Ooh, a new flu. That's what it is. SARS. Oh." SARS, that's not gonna happen again. It's just the flu, just the cold, the sniffles. Don't make a big deal out of it. Yeah. But as soon as people are being quarantined in the millions, you know, that's like the last instance at which you might consider thinking about this a bit differently. I mean, when for the last time have 700 million people been quarantined, a tenth of the world's population? Not all of them were in total quarantine, of course. Most of them, I guess, in self-isolation up to some point. But then again, there isn't much to do when it is forbidden to get out of the house once every 3 days. Don't have many options outside, do you? It's just sad. Just sad. I kind of would like to know what is really going on in China with the people who are infected, and with all the cases that are not being reported, and how the people are suffering from it. But I kind of don't want to know, because maybe that would just be a bit too concerning for myself. I'm not going to lie, it's frightening when you think about being dragged out of your home, or being just put into a cage in a pickup truck and being driven away into some kind of camp, which is supposed to be a quarantine camp with all the medical equipment and medical personnel you need. But, well, it seems like that isn't really the case, that this is just a camp without the funny holiday stuff and without any medical treatment. Just a containment instance. Containment institution, yeah, that's what they should call them. Because there isn't really much going on aside from that, it seems. One thing that's also being brought up all the goddamn time is the bloody hospital they built. When you look at pictures of that hospital and from videos that emerged in the first few days from it, which are of course just rumors and made up videos that aren't really taken there, and they are probably 20 years old, and you know, all the stuff people say, but I think some of those videos are legit, and what you see in them, you know, the entire roofs is leaking. It's just, they would have been better off just putting some shipping containers in there, get some holes for ventilation, maybe a few dust filters or something. That might have been better. But of course, building a hospital calling that a hospital, to me, from what I've seen, is just a farce, if I'm honest. It's not really a hospital that we understand as one in the civilized world, and I'm sure they don't either. But it's good publicity, right? Build a hospital in 10 days! The West cannot do that. Yeah, we can't, but nobody can. I mean, they said they're trying to do something about this, and they're going to demolish the entire thing once this thing is blown over. But they would have been better off just putting some tents up, get some heating in there, and be dealt with it. That would have been, you know, a proper use of the resources they have. Now, I noted a point on my little post-it note that's labeled as "Europe is done." I mean, we're not done, but kind of, because cases are popping up all over the place, and specifically in Germany, the country that I live in. Let's get over here. Shoulder check, indicate, move over. And the country I live in, we've got some cases right around where I live at the moment that are popping up, which is concerning. I talked about that a few minutes ago, but I want to stress that once again, because there's always a difference between viewing something on the news, having some imagery on the television or on the computer, and then suddenly seeing names drop in the news that you are familiar with, that places you've been to in your vicinity. That's a very different thing, and that, you know, makes you feel a bit different. Makes you a bit nervous, even. Might make you a bit scared. Something that I want to talk about at last are masks. And the reasons why you might want to get one. Now, many people seem to buy masks for their own protection. For basically just protection against the virus, or protection from the virus. But the thing is, with this virus, your usual surgical masks aren't really going to cut it, because, you know, they cannot filter out particles that are as small as that. They're basically meant to filter out particles and droplets from the air that you're breathing out. As I was saying, the usual surgical masks are made for, you know, protecting other people from your own germs. Something that would help against these viruses, these incredibly small particles, are very fine dust masks and very fine isolation masks, like FFP3, I think what it is, N95 and 100s, something along those lines. Now, the problem that I have with those, though, is that you're very limited in your protection just to your mouth and nasal area. You should maybe consider getting some goggles to stop things coming in from the eyes, but you also should consider getting a chemical treatment, what's it called, Schleuse, what it is on screen, when you come home, because apparently, since this is an aerosol, you're going to have particles of that all over your clothes, all over your body, all over your skin, and showering with disinfectant is probably advisable when you want to be entirely safe. So the thing is, with protecting oneself from the virus, is that I am not too confident that you are really going to be able to do that securely, safely, practically. So I guess we need to stick to the old saying, wash your hands and do not cough into people's faces. Now, what these masks are good for, though, is protecting other people from yourself. I mean, that's really, like I said, what they are intended for. So what the Chinese do with the mandatory mask wear is that they are trying to limit the spread of the disease by letting everybody wear masks, and therefore having, you know, a bit of a positive effect, a positive negative effect on the spread. Because in the end, People say, well, the guys from the Robert Koch Institute say that 80% of the people are going to have a barely noticeable or mild condition with the COVID-19, trying to keep spreading this even by the people who, you know, do not have any symptoms or mild symptoms is probably a good thing. But I do not think that masks for your own protection are going to cut it. If you can get some, like most of them are sold out. Our German politicians, our German institute leaders are currently a bit worried because at the start of this epidemic in China they apparently sold a lot of those masks to China. And now they appear to not have enough for us, for our medical personnel, for our doctors. That's a shot in the foot. But that's what we are famous for as Germans, right? Shooting ourselves in the foot, in one way or another. Anyways, I hope I'm going to see you soon. Stay safe, take care, and yeah, don't catch the virus. Goodbye.